Hello, I'm Lisa Howe, Health Coordinator for the Bullitt County School District. Thank you for participating in our Medication Administration Training Program for non-licensed school personnel. If this is your first time with medication administration as part of your job requirements, I recommend that you print off the Medication Administration Study Guide before continuing the program. This can be found on the Health Services webpage. You will need to complete the final exam once you have completed this video in its entirety. Print out your certificate of completion and bring it with you to a skills checkoff when you meet with a nurse to complete your training. More details and dates are listed on the Health Services webpage. We have a lot of information to cover. Let's get started. This course was developed collaboratively between the Kentucky Department of Education, the Kentucky Department of Public Health, Kentucky Board of Nursing to ensure compliance with Kentucky Administration Regulation and regulatory statutes. This curriculum is the official training program for all unlicensed Kentucky public school personnel who accept delegation to perform medication administration. The purpose of this course is to provide uniformity in the training across the state of Kentucky, improve safety, reduce liability, and remove education barriers. All unlicensed school personnel who accept the delegation to perform medication administration must show proof of a completion of this course. Training is not complete until the exam is passed with 85% or above and a score of 100% is achieved on the skill competency evaluation. If you should fail either exam, you are allowed to repeat the failed portion once before having to repeat the course again. Local Board of Education shall require proof that all unlicensed school personnel who have accepted delegation to perform medication administration in school have completed a training course provided by the Kentucky Department of Education. This video serves as the official training course required for medication administration. For many of you, this is not your first training, since the training is only valid for the current school year. Here is a breakdown of the 4 modules that will be covered in this video. Legal issues, policies, and procedures. There is more to handing a student medication and keeping the bottle in a drawer. Students with increasing number of chronic complex conditions or illnesses attending school, increasing number of students that require medication, whether it be scheduled medication or an over-the-counter for a symptom, or an emergency medication used for potentially life-threatening situations. With each of these scenarios, there is a potential for an unsafe medication administration. This may result in an unsafe environment for the student and possibly liability for the district. So why discuss the laws? We do this to reduce potential liability, increase safety, remove barriers, increase understanding and compliance, and it is now part of the law. KRS 156-502 defines health services and the provisions that will be made for students needing direct health care. This same law also addresses the Liability Protection Act for school employees performing health services. It is called the Federal Paul P. Coverdell Teacher Liability Protection Act, as you saw on the previous slide. Employees who have been trained and accept the responsibility of performing the procedure are granted liability protection, unless evidence is clear and convincing that harm was caused by the act or an omission of the act. A second liability protection staff have when performing health service is that the task and the employee are working under the nurse's license. You know who can prescribe medication as you seek out your own medical care. Nurses are licensed to administer medication exactly as prescribed and are not allowed to change unless approved by their prescribing health professional. Title of school nurse can apply to a variety of persons. Some states, a licensed professional is not required. Each different nurse title involves different education preparation and scope of practice. Our district currently uses RNs on staff. LPN scope of practice prohibits independent practices and requires the LPN to work under the supervision of designated RN, MD, or dentist. They are not able to delegate the performance of health services to school personnel. Kentucky Board of Nursing has the legal authority to regulate nursing practice in order to safeguard the health and safety of citizens of Kentucky. When the nurse transfers the performance of the task to an unlicensed school personnel, the nurse maintains accountability for the outcome to safeguard the health and the welfare of the students. So even with school personnel performing the task, The delegating nurse retains the responsibility for the outcome. Only RN, nurse practitioners, and MDs can delegate health services in a school setting and supervise the delegated trained person. Upon completion of this course, the non-licensed school employee will demonstrate competency by those listed in this slide. Administration of student medication, verification of student instruction for self-administrating of medications, administration of emergency medications for students with diabetes, allergic anaphylactic reactions, and seizures. When deciding if a task can be delegated to school personnel, certain things must be taken into consideration. Is it prudent to do so? Would the task require the non-licensed member to use independent nursing judgment? And can it safely be done? Depending on the task that was delegated will determine how much supervision will be needed by the person delegating. For instance, how stable or fragile is the student? How competent is the person doing the task? Or how complex is that task? Today's training is delegating only medications to non-licensed school personnel. Supervision of the delegating nurse does not require the nurse to be physically present in the building, but does require the nurse to be available for consultation by phone. Supervision is defined as the provision of guidance by a qualified nurse with periodic observation. The unlicensed school personnel agrees to and has the responsibility to always follow the school district's policy and procedures and perform the task in accordance to the training received from the delegating RN, nurse practitioner, or MD. Unlicensed school personnel should only accept a delegation that he or she knows is within his or her skill set or knowledge. He or she must always report any significant information, contact the nurse for any questions, and or if they feel they have made an error. Never assume anything. Please ask. Remember, the training is only good from July 1st to June 30th, no matter when the training was received. Confidentiality is an important legal concept and of utmost importance with health issues. If you have been to a physician recently, you have heard of the HIPAA. That law protects your health and information in that setting. The Family Education Rights and Privacy Acts, also known as FERPA, is the federal law that protects the student's privacy and their educational records. Health information and health records are protected by FERPA in the school setting. Health information should be shared by school personnel only on a need-to-know basis and never with other students or the general public. If a student shares the health information to an unlicensed school personnel, this information can be shared with a nurse, but not with others that do not need to know. Certain medical conditions require students to have an individual health plan and a red folder. These packets give more detailed information regarding the student's health and may include an emergency action plan. Substitute teachers are all on a need-to-know, as well as bus drivers transporting that particular student. All school districts should have written policies and procedures on medication administration. Bullitt County is no exception, and ours can be found under Chapter 9 of the Policy and Procedure Manual that is online under the BCPS website. Some of the important points outlined in 09.2241 AP.1 include no medication will be administered without proper district forms being completed by parent and/or physician. All medication is brought to the school in the original prescription bottle with label. This would be including our inhaler boxes. We know that many times medication arrives with the students on the bus, so please take every opportunity to educate and remind our parents of our policies. The label on the box or bottle should pertain to the student for which the medication is ordered, and no handwritten changes made to that label. To ensure our students' safety, we must make sure that the current medication form matches the label on the medication to be administered. If there is a discrepancy, then either the label or the medication form must be corrected so that everything matches. If there is a change to be made to either the dosing time or the amount of medication to be given, then a new label and a new form must be received as well. Expiration dates are very important, as medication should never be given past that date. The district utilizes a medication administration form that includes permission for two students to self-carry and to self-administer medications. On this form, two different medications can be addressed. Always make sure the form is completed in full, including the portion the parent signs at the bottom. This area would be the third liability protection that non-licensed school personnel have when administering medications to students. If the medication listed is a prescription, or if the parent is wanting an over-the-counter medication to be kept longer than 3 days, then a physician must sign this form. If the medication is an over-the-counter medication and would be needed less than 3 days, then the parent's signature is all that would be needed. To review, a new form is obtained when there is a change in medication, dosage, time, or frequency, or if you receive a new bottle indicating a change. As best practice and to protect yourself, always count the prescription pills with the parent when they are brought to school. This is another safety practice to ensure that everyone is in agreement to the total. If the medication arrived without a parent in attendance, then have another coworker count the amount of pills received with you. Then write that number on the back of the medication administration record and both witnesses will sign. Here's an example of where to document what you receive from the parent and obtaining a second signature after counting the pills. This form is very important to use with all medications to avoid confusion and discrepancies as to what the school has in possession for that particular child. For an over-the-counter, it is acceptable to write 1 bottle of Tylenol or half a bag of cough drops. Over-the-counter requires a medication form which is different from our medication prescription form and can be given for just 3 days with parent signature. The medication can be given longer if needed, as long as we have a physician's signature on our prescription form. These medications also must be in the original container. No Ziploc baggies are acceptable. Do not administer beyond the expiration date. In order to keep the medications at school to a minimum and to reduce errors, always ask your parents to provide just enough medication for the 3 days allowed. Then follow up with the parents past the 3-day interval to pick up any unused medications. Always refrain from giving a medication if you are unsure of any part of the administration. Parents may not request changes to prescribed medication without the nurse contacting the provider. How we do this second statement in Bullitt County is that our policy states that every form and label must match, so school employees are making contact with the provider to update the forms. If a parent requests that you not give a medication, then they must make quick arrangements to pick up the medication and remove it from the building or send a physician order to hold the medication. Then you would document either the parent picked up the remaining doses or a statement was received from the physician to stop the medication administration. Students are allowed to carry and self-administer certain medications in our district if proper documentation is on file. These medications include inhalers, emergency medications, as well as any medication the provider feels necessary. If medication is being carried on their person, then the paperwork must indicate that approval from the provider. Another regulation that pertains to medication administration in the school setting is KRS 158834. This addresses self-administration of a medication, and the physician's signature and their initials on our district form tells us the following: that this child is capable of administering the medication, knows the purpose of the medication, when and how to administer it, and knows when to seek out the help of an adult. No documentation of administration is required for students that self-administer, but it is still our policy to have completed forms on file in the office. These medications should never be shared with other students, and if found doing so, disciplinary actions must follow. We will review this statute a little later when we discuss field trips. Except for emergency medications, all medications in our district will be kept under lock and key with limited employee accessibility. In other words, not everyone should know where the medication key is kept in the office. Office staff are responsible for making sure that the medication counts are kept accurate. For students receiving medication throughout the school year, it is recommended that no more than 1 month's supply of medication be stored on school property. Is Tylenol locked? Yes. ADHD medication locked? Yes. An inhaler locked? No. Tylenol and any ADHD medication would be under lock and key. An inhaler would be considered an emergency medication and should never be under a lock. Use the back of the medication administration log to document any disposal of medication. Have a witness to co-sign the waste. Inhalers and EpiPens can be placed in the sharps containers that is used for needles. Never pour any medications in the sink or flush in the toilet. For pills, we will pour glue in the container, and once hardened, we can dispose of in the garbage. And for liquids, we will mix with cat litter. Advance notification of all field trips is very important to make certain a medically trained employee will be available if needed. If a student is attending a field trip away from school, a designated trained person must accompany any student that might need medication administered. Thus, trained unlicensed school personnel must stay with the student in case the medication is needed. Unlicensed school personnel cannot give medication to another school employee or a parent chaperone to administer. KDE conferred with the Kentucky Board of Pharmacy, and it was decided that the laws do not allow for repackaging of medication for field trips. Review the field trip permission form with your parents well in advance so that they can reach out to their pharmacy for an extra bottle and an extra label to use for this trip. If not, then the medically trained school employee will need to take the full bottle on the trip. Never transfer a few pills into a Ziploc bag for this trip. In submitting a field trip request on the trip software, the person that is current in the medication training should be the one listed to avoid a follow-up phone call for clarification. Having 1 to 2 backups is a good practice. For a field trip that will occur during the school day, the front office must be notified well in advance. A copy of all medication permission forms will be made, and medications that are to be administered along with any as-needed medications will be gathered. Once you administer a medication on the field trip, you as the medically trained school employee will write the time and your initials on the back of the permission form. When you return to school, it is very important that you transfer that information onto the medication administration record. Then a copy can be shredded. Also, it is very important that you return the medication bottle to the office. It is a good practice to count the prescribed medication with a coworker prior to leaving for the trip. And when the bottle is returned, again, this avoids any confusion and discrepancies. For example, you take 10 Adderall tablets on your trip, and when you return, you ask someone to count the medications to ensure that you are bringing 9 back. If a child has a diabetes packet or asthma packet, severe allergic reaction packet, or a seizure packet, make sure a copy of this accompanies you on the trip. A student with an emergency medication needs to remain with the school employee trained to give the medication. Keep in mind that medication not normally given during school hours may become a factor on an extended field trip. It is amazing how students can be in school for months without medication, but field trip forms indicate previously unknown medications and medical conditions that we now have to address in a short period of time. Please allow ample time to obtain all necessary medical paperwork. The Medication Administration Record, MAR, that is used for school covers only the school days in session. If you will be taking an extended field trip, then you will need a blank MAR to use. Open discussions with your parents in advance to see what accommodations you might need to arrange for regarding the student's medication, such as refrigeration. Kentucky laws only address provisions of health services in school setting. Federal law covers health services for field trips that require out-of-state travel. The scope of practice and the delegation rules specific to each state may need to be taken into consideration for field trips. For this reason, trained personnel may be responsible for the storage of the medication, but the student may self-administer with a trained personnel to supervise. Our district medication form addresses field trips specifically so that the school employee knows their role on the trip, especially when going across state lines. Pay particular attention to the first or second box. If they are checked, then you may travel with your student to any location. The first box states trained personnel to assist student to self-medicate, which means the school personnel will hold the medication until dosing time. The second box has an asterisk and states student to self-medicate, which means the student will hold the medication and self-administer. The asterisk then directs you to the statement below the box and asks for MD initials. Remember, self-administration regulation is that a physician must make that determination, not the parent. If the second box is checked, then there must be a physician initials below the box stating the student is self-sufficient. Let's talk about the third area in this specific to field trip section. It states the employee will hold the medication until dosing time and will administer the medication. Administer is the key word and makes the assumption that you are putting the medication in the mouth. This is one area we must pay close attention to for all our field trips. If you are staying in Kentucky, then your medication training is recognized, and that would be fine for either an emergency medication or a scheduled medication that might be needed. If you are leaving the state of Kentucky and it is checked for an emergency medication, then you are still okay to travel to any location you desire. Emergency situations are handled differently in the legal world. However, and this is very important, if that third area is checked for a routine medication and you are leaving the state of Kentucky, then you must get with Health Services Department to discuss further options. All of this takes time for thorough review and cannot be done in a short time frame. Students have the right to refuse medication, and this is not an error. Document the refusal on the medication administration record. This documents that the medication was offered as ordered. The nurse parent should be notified as soon as possible. Parents must follow policies in order for you to administer medication to their child. If paperwork is missing or the medication is placed in a Ziploc bag, then you do not administer. Notify the parent as to the reason. If a student refuses his lunchtime medication and wants it later in the day, or a dose was missed before they left home in the morning, then these medications cannot be given. Our policy is that a medication must be given 30 minutes before or after it was ordered. Parents can come in and administer a missed morning dose medication, but make sure it is well documented in your notes so that your pill count stays accurate. Medication errors are serious and occur when any of the 6 rights to the medication administration have been violated. They can be the wrong medication, the wrong dose, the wrong time, given the wrong way, to the wrong student, or not documented, and that child received an additional dose. The potential for any of these errors exists in a school setting, especially the wrong medication, such as switching Tylenol for Motrin. If ever unclear, refrain from giving and contact appropriate personnel. What to do if an error does occur? For the safety of the child, admit that the error had occurred and keep the student in the office. Or if in the class when the error was noted, then send someone to find the child. Observe and document the status. For any distress, call 911. Otherwise, notify a school administrator, parent, and their physician if able. Again, accidents do happen, and in the best interest of the student's health and safety, report all these errors promptly. To avoid making common medication errors, focus on the task at hand. Avoid distractions when performing medication administration. Prepare and administer one student's medication at a time. Administering to only one student at a time will help decrease potential for errors. Look at that label 3 times when administering the medication, when removing from storage, when removing from the container, and when returning the bottle to storage. You saw that child's name and the medication type 3 different times to ensure accuracy. When calling the Poison Control Center, there are no privacy violations. Give them as much detail as you can. If you are unable to follow their orders, or if there could be a delay in following the orders, then make sure they are informed of that situation. For example, you are at Bernheim Forest and they say to have the child drink 16 ounces of water, but you have to walk a mile to reach that water. This would be something the center needs to know, as they might suggest something different for you to do for the student. We will review the different types of medications in Module 2. Prescribed medications are those medications that a licensed practitioner has ordered for the treatment of the student's particular diagnosis or symptom. They include controlled scheduled or non-controlled scheduled. They may be ordered routinely or as needed. Controlled or scheduled medications such as Ritalin or Adderall are potentially addictive and therefore regulated. They can only be obtained with a prescription and must be strictly locked up. Document all administration and count with the parent when it is received at school. This is very important with all controlled medications. Non-controlled or scheduled, such as antibiotics or Dilantin, can only be obtained with prescription. They must be kept under lock and key. Document all administration and count number of pills with the parent when received at school. Over-the-counter medications such as Tylenol or cough drops are customarily on an as-needed basis. The district requires medication permission forms to be completed for all over-the-counter medications. To review, parent signature is only good for 3 days, and the medication must not be self-carried or self-administered. If the parent wants an over-the-counter medication kept at school the entire school year or carried on their person for their son or daughter, then a physician's signature would be required. Remember with all medications that many have a brand name and a generic name. Medication orders and prescription bottles may have different names for the same medication because a generic was given. If ever in doubt, contact a nurse for clarification. Currently, our district does not supply medications to students such as Tylenol or Neosporin. Here is a website of common adverse reactions with certain medications. Knowing what to expect with your students following an administration is always beneficial for all involved. All medications have the potential of unwanted, unexpected, or dangerous reactions. Reactions can range from nausea and vomiting to redness, rash, or itching, or the most extreme, anaphylaxis, which is the most life-threatening allergic reaction. Emergency action should be implemented if anaphylaxis is ever suspected. Observing a student after a medication is given is important. Some medications have less side effects if given with food and are ordered with meals. If ordered that way, make certain the student did eat his or her lunch. If a student would vomit after taking the medication, report to the nurse the medication that was given and the interval between administration and when the vomiting occurred. Different forms of medications come to the school setting each year. They include oral, topical, inhalers, and emergency medications. All oral medications should be given with 4 to 6 ounces of water. After the student has received the medication, it's very important to make sure the student swallowed the medication. Inhalers and emergency medications will be discussed later in Module 2 and 3. Tablets can be given many different ways. For example, chewable tablets are meant to be chewed before swallowing. Always follow the directions on the label. Some are scored and have a line on them, which means the medication is evenly distributed in the tablet and can be broken or split to reduce the dose. Unlicensed school personnel are not allowed to split these scored tablets. Always ask the parents to do this for their child prior to bringing the medication to school. Buccal and sublingual are 2 types of oral disintegrating tablets that are usually seen in the school setting. Another form of oral medication is capsules. They are coated so that they will not start working until they reach the stomach or the intestines. They are also like capsules designed to be broken open and sprinkled into soft food, like applesauce. They are called a sprinkle and are most often given to students with asthma or those that have seizures. Enteric-coated capsules are covered to protect the stomach from irritation. Do not break or crush any medication considered slow release, sustained release, long-acting, extended, or controlled release. These can be identified by the abbreviations EX, ER, CR, LA, or SR. Cutting or crushing or sprinkling of the medications are examples of changing the form of an oral medication. The prescribing healthcare provider will indicate this change on the label. In our district, we request that the parent or pharmacy pre-cut all medications prior to bringing them to school. Some medications are light sensitive and are kept in a full liner. In these circumstances, it is the orders to cut the pill in half prior to administration, then it would be permissible to do so as the unlicensed school personnel. Syrups and elixirs are clear liquids. Suspensions are liquids that are not clear and usually need to be refrigerated. Because suspensions can separate, they always need to be shaken at least 15 seconds before being measured and given to the student. Topical medications can include eye drops or ointments, ear drops or ointments, and creams and ointments that are applied to the skin. Please note gloves should be worn when administering any of the above medications. All gloves should be vinyl when supplied by the district to protect those with latex allergies. Handling medications. Before administering any medication to a student, always wash your hands for 20 seconds. Alcohol-based hand sanitizers are an excellent alternative to washing when soap and water is not available. Avoid touching the medication by pouring the pills into the lid of the bottle. Then have the student pick up the medication themselves and self-administer. Medication administration. SMD-RTD. SMD-RTD. Student, medication, dosage, route, time, documentation. These are the 6 rights of a medication administration. You need to double, if not triple check, these rights each time you administer a medication. For right student, you need 2 identifiers, photo on the MAR and have the student state his or her name. If you are on a field trip and have no access to a photo, then confirm with another teacher that you have the correct child. For right medication, you will look at that label 3 different times. For right dose, compare the label to the medication administration record or the permission form. For right route, make sure eye drops go in the eyes, ear drops go into the ears. For right time, we have 30 minutes before and after a time medication is ordered. For right documentation, all medications administered by school personnel must be documented after it is given either in Infinite Campus or a paper MAR, depending on the medication. This also includes all medications given on a field trip. Failure to document or inaccurate documentation is considered a documentation error. This may cause a second dose of medication to be administered, leading to an overdose. If a student is to receive medication during the school day, then it is our responsibility to make sure that happens. Develop whatever reminder system is necessary to ensure appropriate delivery times. Here are the steps in administering an oral medication. With each medication we review, you will always end the medication administration with DRO, document, replace, observe. With an oral medication, you pour your medication into the lid, provide water, verify it was swallowed, then DRO, document, replace, observe. When you sign initials and name to the MAR, then you are verifying that the child received the medication. When using a plastic marked medicine cup for a liquid medication, place the cup on a solid level surface and look at the medicine cup at eye level to ensure the correct amount has been poured. If a student is to receive more than 1 liquid at the same time, each liquid medication must be measured separately. When pouring the medication out of the bottle, always hold the bottle so that the label is in the palm of your hand to prevent spillage and causing the label to be illegible. Here are the steps in administering a liquid medication. Cup at eye level, label in the palm of your hand when pouring, verify that the medication was swallowed, DRO, document, replace, observe. For eyes, ears, and topical medication, you always wear gloves. Here are the steps in administering eye drops or eye ointments. You'll have the student tilt their head back or lay down, have the student look up, and form a pocket by pulling the lower lid away. Place the drops in without touching the eye, but if it's an ointment, apply a thin strip into that pocket. Have the student close their eyes, dab excess away. Remove your gloves, DRO, document, replace, observe. For eyes, ears, and topicals, we always wear gloves. And here are the steps for ear drops. You're going to fill the dropper with the medication, tilt the head to the opposite shoulder, pull the ear back and up and hold. Place drops without touching the dropper to the ear. Have student remain with their head at the opposite shoulder for a few minutes. Remove your gloves, DRO, document, replace, observe. For eyes, ears, and topical medications, you always wear gloves. Here are the steps in administering a topical medication. You'll put the medication on a Q-tip and you'll apply the medication, cover the area, remove your gloves, DRO, document, replace, observe. Here are the steps in administering a nasal spray. Have the student blow their nose, block one nostril with finger, insert nozzle into the other nostril, aim up and outward toward the ear, avoid aiming inward. Have the student exhale, squeeze quickly and firmly as the student inhales at the same time. Repeat if necessary, DRO, document, replace, observe. Oral inhalers deliver medication directly to the lungs through the mouth by squeezing the canister or by direct inhalation. The nebulizer produces a fine spray mist by rapidly passing air through a liquid that is inhaled through the mouth. Individualized training will be offered if you have a student that has a nebulizer. Please contact Health Services to set up a training date. The average national statistic is that a classroom of 30 students will have 1 in 5 will have asthma. In Kentucky, we average 1 in 3. All students with asthma should have an asthma packet on file, and you should know the details of that packet. This paperwork is completed each year, and it outlines the triggers that place your child in danger. Know those triggers. By statute, these children can carry their inhaler on their person as long as the physician has properly completed our paperwork. If you witness a child using an inhaler, please check with the office to make certain an asthma packet is on file. Additionally, this ensures the medication is given as ordered. Here are the steps in administering an inhaler. Shake inhaler, especially if it's been sitting in a drawer for a prolonged period of time. Make sure the canister is firmly positioned. Tilt the student's head back slightly. Standing can also increase lung capacity. Ask the student to exhale. Then place the mouthpiece between the teeth and close their lips around it. Squeeze and inhale. Continue to breathe in deeply 3 to 5 seconds, holding the medication in the lung for 5 to 10 seconds. Rest and repeat, giving at least a minute between puffs. DRO. Document, replace, observe. Here are the most common problems when using an inhaler. If a child drops off an inhaler on the first day of school and never touches it until next spring, it will need to be shaken before use. A minute between puffs at minimum, or longer if direction indicates. This is especially important for student athletes. If the medication is not taken as properly prescribed, the medication will not effectively treat the symptoms, and respiratory compromise may develop. Make certain that you know when the child should take his or her inhaler. Incorrect activation can occur by not following the recommended sequencing of inhaling and squeezing the canister. Please watch the following video on administering an inhaler.
Inhaled medications are essential for preventing and treating asthma attacks, but the medicine is only effective when you use your inhaler correctly. Without proper use, your inhaler may not deliver enough medication to your lungs to control your symptoms. To properly use your inhaler, follow these simple steps. First, take off the cap of your inhaler and remove any lint or objects in the opening. Shake your inhaler for 2 to 5 seconds. Remember, if it has not been used for more than 48 hours, you must prime your inhaler. To prime your inhaler, depress the canister once. This ensures the next dose will deliver the correct amount of medication. Next, sit up straight or stand up. Breathe out all the way. Tilt your inhaler slightly and put it into your mouth with your lips sealed around the mouthpiece. As you begin to slowly breathe in, depress the canister. Remember, in order to deliver the medication into your lungs, it is important to start breathing in before depressing the canister. Continue to slowly breathe in over 3 to 5 seconds until your lungs are full. Hold your breath for 10 seconds, or as long as you can. If you need to take a second puff of your inhaler, wait 1 full minute between puffs. You should rinse your mouth out with water after using your controller or inhaled steroid inhaler. Be sure to spit out the water after you're done rinsing your mouth. Recap the inhaler for storage.
Your responsibility in caring for a student with asthma is the following. Where is the inhaler to be kept? Who will administer? Self-administered or is it assisted? When is the inhaler used? It cannot be our determination if the medication is self-administered or assisted. Please review all forms provided by the parent or guardian. Record keeping is very important when medication is given at school. A medication administration record, or MAR, is kept for every student that has a medication at school. Always complete the top of the form and you will cover all the requirements. All medications need to be entered in an Infinite Campus also, with the exception of inhalers and 3-day medications. It is important to be aware of student allergies. However, in Bullitt County, we never administer anything not provided by the parent or guardian. Attach a student's picture to the MAR. Each form is only good to the current school year for one medication and for only one time of the day. So whenever there's a change in medication, dose, or time, the student will need a new form. The old form will be placed in the student's cumulative folder. In Bullitt County, we mainly use paper charting while on field trips, medications that are kept in teachers' rooms, and inhalers. A child receives Adderall at 9 a.m. and again at 2 p.m. How many MARs would he or she have? The student would have two forms, one for the 9 a.m. dose and the other for the 2 p.m. dose. This will be true for Infinite Campus as well. The student should have two different scheduled appointments for the medication. On August 7th, the child receives 10 milligrams of Dilantin at 9 a.m. On October 12th, you receive a new form that states 15 milligrams at 9 a.m. What needs to be done? You're going to confirm the label that also states 15 milligrams. You'll place the first MAR and permission form in the cumulative folder. You'll start a new MAR or make necessary changes to Infinite Campus. The MAR is a permanent part of the student's file and is considered a legal document. Record and initial the actual time on the MAR. Never record prior to giving the medication. Document on the MAR if the medication is missed due to a field trip, student absence, or a refusal. Use only ink, never use white out. If a mistake is made, draw a single line through the time and write VOID and initial. For inhalers that might be given frequently throughout the day, the district has a different form that can be obtained from health services. The medication record log can be used to make notes of additional comments or any unusual circumstances related to the student receiving the medication. Here's a copy of our MAR. This would be the form that the front office would utilize because only the school days and sessions are left blank. If you are a sponsor of a field trip and your trip would take place over a break, then you would need to contact health services for a blank MAR. Place corresponding signature to your initials to the bottom left. Use documentation codes of the bottom right to fill the boxes above. For a scheduled medication, there should be no blanks. Either the employee's initials or documentation code would be found in each box. Here are the most common abbreviations you might see in a school setting. Especially, you'll see PRN, when needed or as necessary. Module 3, Emergency Medication Administration. KRS 158838 permits the delegation of glucagon, Diastat, and EpiPen administration in a possible life-threatening event, as well as Narcan for opioid overdose. This regulation also requires that each school district to have at least one school employee who meets KRS 156502 requirements to be on duty the entire school day to administer emergency medications. The entire school day is a vague guideline. Bullitt County interprets this to mean any school-affiliated activity. KRS 158838 permits the delegation of glucagon, Diastat, EpiPen, Klonopin administration in a possible life-threatening event, as well as Narcan for opioid overdose. This regulation also requires that each school district to have at least one school employee who meets KRS 156502 requirements to be on duty the entire school day to administer emergency medications. The entire school day is a vague guideline. Bullitt County interprets this to mean any school-affiliated activity. General guidelines for all emergency medications. Emergency medications must be available for quick access for those that are trained to administer. However, we need to make sure they are kept in a secure location. They should never be left on a bus. All expiration dates will be checked monthly, and we will give the parents 1 month advance notice of this upcoming expiration. Please note these dates on arrival to the school and periodically recheck them. Whenever an emergency medication is given, someone must call 911. Give ownership to this person of the task. This person should also meet the emergency medical response team at the entry point of sight and escort them to the student. The EMS team may or may not take the used injector from you, but please make every effort to send it with them. If you are a coach and have a student athlete that has an inhaler or an emergency medication, it is recommended that you look at the medication from time to time and know where this medication is kept. Make sure the medication is not expired and that all the equipment needed is available in case of an emergency. Have a verbal agreements with your student athletes. Some coaches have told me they use a buddy system. The child with the emergency medication always places their gym bag next to the buddy so that it can quickly become identified. Remember that students that self-carry might not have their medications always with them. If you find that to be true, please contact health services and parent. We need you to be prepared. There are two types of diabetes, Type 1 is not related to eating habits, and this is the type we have mostly in our district. Their body does not make insulin, which is necessary for the cells in the body to have energy. The cause of type 1 is unknown, but it may be viral in nature. These students must be managed the entire school day, and the time must be allotted to meet their needs. Type 2 is linked more to genetics. Diabetes is a chronic, progressive metabolic disorder that can cause a child to develop long-term complications of the eyes, kidneys, feet, and circulation. If blood sugars are not kept in a specific range, these complications can start developing quickly. There are abnormalities in breaking down carbohydrates, fats, and the proteins that we eat, leading to hyperglycemia or high blood sugar. So let's talk about diabetes. In people without diabetes, sugar will enter the cells for energy, and the blood sugar levels remain in the stable range. Insulin is the key that opens the doors to the cells and lets the cells use the sugar for energy and activity. They have normal working keys and locks. There are some major differences between type 1 and type 2 diabetes. In type 1, the body does not make enough insulin, therefore no keys. So the cell doors cannot open for the blood sugar to be used for energy and activity. Insulin is the necessity to survive. So individuals with diabetes have to have their insulin or their keys provided through another route. In type 2, insulin can and is often used to manage, but lifestyle changes of meal plan, activity level, or oral medications are also used. Oftentimes their keys do not fit. This is a picture of a young girl who had type 1 diabetes but was not under treatment with insulin. In the early 1900s, the diagnosis of diabetes was a death sentence. Insulin was not available for human use until 1922, and before then the only treatment was diet restrictions that were so severe that children sometimes only got 400 calories a day. Thus many of the children starved to death. Then as of now, diet is a key component in maintaining a stable glucose level. This is the same child about 6 weeks after being started on insulin. Hypoglycemia or low blood sugar is usually considered for a blood sugar reading less than 70 or 80. Each student with diabetes who requires insulin at school should have a diabetes health care plan. Because hypoglycemia symptoms may range from mild to severe, the student's licensed healthcare provider will write a plan of treatment describing how to treat the symptoms based on severity. Administering glucagon is usually the last type of treatment for extremely low blood sugar, and the student is unable to eat or drink liquids. If these symptoms of hypoglycemia are detected early, other forms of treatments are usually prescribed to be given first. Often checking a blood sugar before and after a physical activity can prevent a low reading. Never send a child to the office alone, especially if they are showing symptoms of low blood sugar. Hypoglycemia is the most frequent complication for students with diabetes who require insulin. Nurses will administer a calculated dose, but we cannot take into account what else is going on in the body, such as illness, stress, or hormones. These may not be all the causes of hypoglycemia or low blood sugar. Student health plan or emergency action plan may identify others. Students' diabetes package should detail how to treat hypoglycemia, mild, moderate, or severe symptoms. For extracurricular activities, a change in the student's normal activity, or delay in eating such as a game is delayed or goes into overtime could affect blood sugar levels. To prevent a dangerously low blood sugar, check blood sugar levels frequently and carry snacks. For a blood sugar reading less than 70 or 80, a quick recovery plan is called the Rule of 15. Have the student eat or drink a fast-acting carbohydrate, limit to 15 grams to prevent the high reading later. Examples would include 3 to 4 glucose tablets, a half a cup or 4 ounces of a juice or regular soft drink, or a package of fun-sized Skittles. Need you to read the labels and make certain you are seeing serving size. Check blood glucose 15 minutes after a treatment. Have someone call the school nurse if that second treatment of quick-acting carbohydrates is necessary. Repeat treatment of 15 grams of fast-acting carbohydrates if blood glucose level remains low, and recheck at another 15 minutes. If symptoms continue or blood glucose levels do not increase, have someone call parent or guardian, or if needed, have someone call 911. It is important to provide the student with a snack, such as peanut butter or crackers or half a sandwich or a meal following the treatment of hypoglycemia to stabilize the blood sugar. Glucagon is available to people with diabetes for when they are experiencing a very low blood sugar. It is the responsibility of the parent to provide the glucagon. The amount of glucagon to be administered is located on the label as well as the diabetes packet. It is a weight-based medication. Always follow with a snack once the child is awake and talking. Be prepared for the child to vomit following the glucagon injection as the blood sugar rises. Keep the child in a side-lying position for recovery. Here are some common signs and symptoms of low blood sugar ranging from mild to severe: shaking, hunger, weakness and fatigue, headache, irritable, sweating. Usually the child will have the same symptomatic characteristics when experiencing a low blood sugar. If you have a diabetic student in your class, it is always best to ask the parent for what you should watch for. These descriptions should be outlined in your subfolder. Be prepared for low blood sugar readings, especially when you are away from school. Make certain that you take a quick-acting sugar and a slow-acting carbohydrate for your diabetic students. You must be prepared for the delay, either getting a meal or returning to school. Ask your parents to provide the food sources. If they are not supplied, contact health services for some additional food. Child eats lunch at 11:30 a.m. She comes to the teacher at 9:45 complaining of feeling shaky or low. What needs to be done? If supplies are kept in the office, then send the student there with an escort. Check sugar. If treatment is required, we'll give a simple sugar. But would we wait to give a carbohydrate or wait for lunch? We're going to give the carbohydrate. Anything longer than 30 minutes is too long to wait. Question to self: did I recheck the blood sugar after a treatment? Remember, you must check blood sugars 15 minutes after all treatments. Always document that follow-up number. If not documented, then it appears the blood sugar was not rechecked. According to KRS 158838, each local public school district is required to have at least one school employee on duty during the entire school day to administer glucagon in an emergency. Glucagon is life-saving injectable hormone prescribed for students that are unconscious and unable to swallow. It will not harm the child if given. Please watch the following video for glucagon administration.
Hello, my name is Mara, and I'm a certified diabetes educator here at Boston Medical Center. Today, I'm going to be teaching you how to use the emergency medication called glucagon. Glucagon is a medication used to treat severe hypoglycemia or low blood sugar when a person with diabetes is unresponsive or unable to swallow food or drink. While insulin decreases the sugar in the blood, glucagon works the opposite way to increase sugars in the blood when it is too low. If a family member or friend who is using insulin is unconscious, jerking, or unable to swallow, glucagon should be given, even if you're not sure the cause is low glucose. Food or sugary drinks should not be given to someone who is unconscious or unable to swallow safely. This is where glucagon can be life-saving. If you need to administer this medication, please call 911. Emergency responders can talk you through the process if you are in need of assistance. If you are comfortable injecting glucagon, give the injection first, then call 911. Glucagon is prescribed by your doctor. It comes in a handheld kit with the expiration date printed on the outside of the container. On the inside, you will find two items. The vial contains the powdered glucagon. The syringe contains a pre-measured solution. The kit has easy-to-follow instructions on the inside to guide you through the process. Please take time to familiarize yourself with the instructions when you first pick it up from the pharmacy. The first step is to remove the lid to the vial. You can do so by popping it off with your thumb. Place the vial on a flat surface. Next, starting with the plastic near the plunger, remove the safety mechanisms on the syringe. Insert the syringe into the vial. Push all of the liquid from the syringe into the vial. With the needle still inserted into the vial, swirl the solution until it is clear. You do not need to worry if air bubbles form. Next, flip the vial so the needle is facing upward. Pull all of the contents of the vial into the syringe. You may need to pull the needle towards the opening of the vial to draw out all of the solution. Now you are ready to inject the person with glucagon. If available, wipe off the site with an alcohol pad. However, this is not necessary in the case of an emergency. This shot is meant to go into the muscle, but will work fine anywhere where insulin is usually injected under the skin. The back of the arm, thigh, and buttocks are good locations. Hold the syringe like a pencil. Quickly insert the needle at a 90-degree angle or straight up and down. Inject all of the solution into the person. Place the used needle into the container to keep it from falling or puncturing you. As glucagon starts to work, it can make the person feel nauseous or vomit. You need to move the person onto their side to avoid the risk of choking. The person should become alert within 15 minutes. When the person has regained consciousness and is capable of swallowing, give them 4 ounces of fruit juice or 6 ounces of regular soda, and follow with a snack containing carbohydrate and protein, such as crackers and peanut butter or cheese. Stay with them and keep their glucometer handy to check a blood glucose once they are alert. Contact their doctor to inform them of the severe hypoglycemic event. If you are a parent, partner, friend, coach, roommate, or teacher of someone who has diabetes, especially if they are using insulin, please learn where the person's glucagon kit is and how to use it. Remember, if you need to administer this life-saving drug, there are instructions in the kit and emergency responders can walk you through the steps.
Hyperglycemia or high blood sugar is usually a reading over 200. Most common examples of high blood sugar are extreme thirst, frequent urination, hunger, and drowsiness. These children need access to the restroom without penalty. Allergic reaction is an immune response to a foreign substance where the symptoms may appear immediately or not for several days or weeks. In the case of medications, the drug itself may be the substance that causes the effect. Anaphylaxis is the most dangerous allergic reaction and can be life-threatening if not treated immediately. Signs and symptoms include drop in blood pressure, so the student or coworker becomes very weak and short of breath. The EpiPen is a prescribed medication that contains epinephrine to reverse the most dangerous effects of anaphylactic reactions. There is no need to remove the clothes, but avoid going through double seams of blue jeans. One of the hardest parts is recognizing what you see and reacting to it. EpiPens can be self-administered if able to reach the pen quickly before becoming debilitated. The statute allows students to self-carry. It is recommended that the parents provide a second pen for the office. All teachers, staff, coaches should know where the epinephrine is kept for each particular student. These locations should not change from semester to semester. Remember, epinephrine injections are not interchangeable between students. Who is at risk for anaphylaxis? Students with asthma because they have a lung involvement, students with spina bifida because of latex allergies. Anaphylaxis is hard to predict and the allergic response might escalate and become life-threatening. If you see any of the 2 above listed symptoms, you must react quickly. Many classrooms are designated peanut-free. This would be at the order of the physician and found in the allergic reaction packet. Peanut-free tables are also made available at each school if ordered by the physician. Please remember that peanut oils can best be removed with soap and water. Discuss this with your parents to ensure the child's safety. Signs can be placed outside the rooms to signal everyone that peanut tree nuts are not allowed in the room. Please include this information in your subfolder so that they do not eat in the room. Again, know the location and check the expiration dates of all epinephrine pens monthly. Epinephrine is normally made by the body and it will not hurt the child if a dose was given for a possible reaction that was not needed. If your student has an inhaler and an EpiPen and comes to you without being able to breathe well and also has a look of impending doom, skip the inhaler and go straight to the EpiPen. It will reverse the anaphylactic reaction and it will also help to relax the airway. The inhaler would only work on breathing and not reverse any allergic response. To administer EpiPen, always seal your thumbs in a tight grip with the EpiPen. Never touch the orange tip, especially after the blue cap is removed. Hold in position for a count of 3 and give only in the thigh. Please watch the following video for EpiPen administration.
A life-threatening allergic reaction, anaphylaxis,
is unpredictable. It could be mild 1 minute, then suddenly...
It's scary, like you can't even breathe scary.
Or your skin gets all itchy and breaks out into hives scary.
or your throat starts to tickle and close scary. It's different for everybody.
Every reaction is different. A mild reaction one time can be life-threatening the next. So it's important to know your body and know when it starts to feel funny. It could be the warning signs of anaphylaxis.
So it's also important to know how to use one of these.
An EpiPen auto-injector.
EpiPen and EpiPen Junior are for the emergency treatment of life-threatening allergic reactions.
And for people who are at an increased risk for these reactions.
EpiPen and EpiPen Junior should only be used to help someone during an emergency.
Ready to show them how it's done?
Yeah,
EpiPen Junior, the one with the green label, is for kids.
like me.
An EpiPen with the yellow label for bigger people, like me.
Whether you need to use EpiPen on yourself or give it to someone else, you can just follow these simple steps. So first things first, you take it out of the tube,
Just flip open the yellow cap,
or the green cap,
slide it out, and hold it like this.
Blue to the sky,
Orange to the thigh.
Then you take off the blue cap.
Blue safety release.
never put your hands near the orange tip because that's where the needle comes out.
The needle is designed to go through clothing, including jeans, because it must be injected into the outer thigh for quick absorption. If you're helping a young child,
Like me.
hold the leg firmly in place. Once it is,
You just do this.
Boom.
It clicks, so you know it worked. Then you hold it there for 3 seconds.
Then, remove EpiPen.
you'll still see some liquid in there, but don't worry, your EpiPen Junior auto-injector gave you the right dose, and it has a special feature, the never see needle.
Yeah, so the needle's totally covered up.
So you should never see the needle.
Then rub the spot for 10 seconds while you or someone else gets emergency medical help right away. Call an ambulance.
Or have someone take you to the emergency room. Just make sure to do it immediately.
And you should always carry 2 EpiPen auto-injectors wherever you go. They even come clipped together.
Because some people might need the second dose.
AviQ is the same medication but a different mechanism of injection. It is voice activated and has shortened the time for the injection from 5 seconds down to 2. The AviQ will now count to only 2 but at a slow pace. Hold in position until you hear the beep. Please watch the following video for AviQ administration.
If having an allergic emergency, pull red safety guard down and off of AviQ. Place black end against outer thigh. Then push firmly until you hear a click and hiss sound and hold in place for 2 seconds. 2, 1. Injection complete. Seek emergency medical attention. This AviQ has been used and should be taken to your physician for proper disposal and a prescription refill.
Generic epinephrine pen is the same medication that is in AviQ and the EpiPen. With this epinephrine injection, there will be an exposed needle that does not retract. It is extremely important to recap using the one-hand technique. After removing both protective caps, you will see the red end that needs to go toward the thigh. Please watch the following video to learn the steps to a safe and successful injection. Again, always recap using the one-hand technique since there will be an exposed needle.
Hi there, I'm Linda. I'm here to show you how to use the epinephrine injection USB auto-injector, the authorized generic of Adrenaclick, to treat emergency allergic reactions known as anaphylaxis. These serious allergic reactions are commonly the result of an insect bite or sting, or allergy injections, foods, medicines, latex, and even exercise. Sometimes the cause of the allergic reaction is not known. In each of these situations, the recommended treatment is epinephrine, the medicine you get with our auto-injector. The epinephrine injection USP auto-injector is for immediate administration and does not take the place of emergency medical care. You should get emergency medical help right away after using the auto-injector. You can learn how to use it by working with your healthcare professional, following the instructions, and watching this video, just like Mark did. Right, Mark?
That's right.
Adults like Mark will be prescribed the autoinjector with the yellow label. This autoinjector contains the proper dose of epinephrine for people weighing more than 66 pounds.
That's what I got right here.
Okay. Now, let's remove the autoinjector from its case. Great. Now you should be regularly checking the medicine through the viewing window. If it looks cloudy or discolored, or has any particles in it, or if the expiration date has passed, the autoinjector should be replaced. Now, note the blue end caps. When you're ready to use the autoinjector, pull off both blue end caps. Do not remove the blue end caps until you are ready to use the autoinjector. With the blue end caps removed, you'll see a red tip. The needle comes out of that tip, so never put your thumb, fingers, or hand over it. If an accidental injection does happen, get emergency medical help right away. Grasp the autoinjector with your fist, with the red tip pointing downward. Perfect. Then put the red tip against the middle of the outer thigh at a 90-degree angle. Right. Now press down hard and hold firmly against your thigh for approximately 10 seconds to deliver the medicine.
Wait, it works right through whatever you're wearing?
Right. It's designed to work through your clothing.
But what if I want to have the shot in my arm?
Sorry, no. The injection is meant for the upper leg, nowhere else. In fact, if you are accidentally injected anywhere else, you need to seek emergency medical treatment right away.
Okay, got it.
Next, remove the autoinjector from the thigh and massage the injection site for 10 seconds. It is normal for most of the medicine to remain in the autoinjector after the dose is injected. The correct dose has been administered if you see the needle sticking out of the red tip.
But what if I don't see a needle?
If you don't see the needle, you did not receive an injection. You need to repeat the injection process. The epinephrine injection USP autoinjector is a single-use injectable device that delivers a fixed dose of epinephrine. The autoinjector cannot be reused. Do not attempt to reuse the device after it has been activated. Next, get emergency medical help right away. Your symptoms might continue or return, and you could need additional medical care, including a second injection.
So now we take care of the used autoinjector, right?
You got it. Carefully slide the device needle first into the black carrying case on a flat surface. After the needle is inside the case, push the colored half of the case firmly over the non-needle end of the autoinjector. When you see a healthcare provider, tell them you've received an epinephrine injection. Show them where you were injected, and give them your used autoinjector for inspection and proper disposal.
Anytime epinephrine is given, 911 must be called. That injection might only last 10 to 15 minutes, and maybe that is all the individual needs. However, they could need more and have a rebound reaction, and it could be worse than the initial. If the child would initially show improvement, but then started showing symptoms of anaphylaxis again, and the emergency response team had not arrived yet, then you could give a second injection if there was another pen available at the school that was prescribed for this particular student. You would inject into the other thigh. Never take another child's EpiPen to use. Epilepsy is a neurological disorder that causes seizures. There is a disruption in the electrical activity in the brain that causes loss of awareness, shaking, convulsions, or sensory experiences. Some may last a few seconds or may be missed or up to a few minutes. They can take many different forms, but not all seizures result in a loss of consciousness. The outward symptoms we see depend on where in the brain the disruption is occurring. This is why it is so important to describe exactly what the student is doing during the event. Seizures alter movement, sensation, behavior, and awareness. Anything the brain knows to do can be stuck in a repeat mode. Generalized seizures mean the whole brain is affected, where the child will have convulsions, muscle rigidity, and jerking. We will discuss 4 types of generalized seizures: tonic-clonic, absence, atonic, and myoclonic. Tonic-clonic or grand mal seizures are what most people think of when they think of epilepsy. Getting the child to the ground is the safest place for the child when they are having a seizure, unless they are secured in a wheelchair. Since absence seizures can be so frequent, 50 to 100 times a day, they can lead to the student struggling in the classroom. During each of these attacks, the child misses what you're saying And if you are teaching a building concept, this child might not be successful. During an absence seizure, it can look like the child is daydreaming and then return promptly to normal activity. A tonic or drop attack is an abrupt loss of muscle tone with a very quick recovery. The child might fall completely on the floor or maybe just stumble depending on the length of the event. Myoclonic is a rapid, brief contraction of the body muscles, usually at the same time or both sides of the body. Partial seizures affect only one side of the brain. Complex partial is what we have mostly in our schools. You will see random activity and the student will be out of touch with the environment, much shorter in duration than a grand mal seizure. Simple partial seizures are the type of seizure where the student will stay conscious. They will experience a sensory phenomenon or a jerking in one or more parts of their body. When a person is having a partial seizure, it is important that the person is kept safe during the event. Use your body as a shield from steps, outdoors, and traffic. Avoid grabbing someone while they're having a partial seizure, as they may become aggressive. There is no first aid needed for these types, but if they are wondering, then safety would be a key factor. Always time every type of seizure and document the event. Please watch the following video of some common seizure types noted in schools and the treatment that would be needed.
Some people call epilepsy or seizures a brainstorm, a storm in the brain. But what does that mean? Well, it means that this normal activity where the cells are signaling from one to the next is basically doing it in an uncontrolled way. So it keeps going and going and going. Depending where in the brain that activity happens, your seizure looks different. It could be a repetitive thought. It could be a vision. It could be a smell.
It can also be the classic thing that people tend to think of when they're thinking of seizures, and that's the tonic-clonic seizure, or what we used to call the grand mal. It can also be, on the other side of the coin, what we used to call petit mal, where all we're seeing is an absence of a person. They just go blank for a moment, stare off, maybe a little bit of movement. And so we have the huge range from the biggest, the strongest, the most worrisome for most people, the grand mal or the tonic-clonic, all the way down to a little bit of movement or simply staring.
More than 300,000 students in the U.S. live with epilepsy. Working in the school system, chances are you'll encounter a student having a seizure.
When he started school was the biggest fear of my whole entire life, not knowing when you were going to get that call.
And then she started having a seizure. We were pretty scared. So I sent some students down to the security office. I sent another student to another room to hit someone else's security button, and I tried to call the clinic. The clinic went directly to voicemail.
Attempting to get help is the right thing to do, but how can a teacher assist while waiting for help to arrive?
The first thing they should do is make the child safe. And so that involves making sure there isn't something near the child's head in particular, okay, that could produce some danger.
The next thing you do, if the person has glasses on, you want to take them off, loosen their clothing. If you can ease them to the ground, allow them to go to the ground, and then turn them on their side.
It's helpful to do that because what's often happening, and it makes people very scared, is that you hear guttural sounds, as though they're having trouble breathing. And so what you're trying to do is to allow the head to turn to the side so the saliva, okay, which the person isn't able to swallow at that time, can come out of the mouth.
You will want to get help. In the school rooms, they have buttons that you can push to get help. You can ask someone else to go get help. Call the health room. And if this is someone that's known to have seizures, they'll come with an individualized care plan, which will say if this person has medications or not.
Things not to do are to either put something in someone's mouth or think that they're going to swallow their tongue. The tongue is actually attached to some pretty big muscles in the throat. And so while patients may bite their tongues, they aren't going to swallow them. The more dangerous thing is that if you put something in someone's mouth that's rigid, they may crack a tooth. If it's something that's soft and they could potentially bite off, then the part that they bite off may actually be aspirated or go into their lungs.
Safety, clear the environment, roll them to their side, and then just stay with them and allow it to run its course. There is nothing that a person can do to change the course of that seizure.
A tonic-clonic seizure is not usually dangerous to the individual, but there are a number of points to consider when deciding whether emergency medical services should be called or whether the student should be transported to the hospital. Medical services should always be called for students having a first-time seizure. EMS should also be called under any of these conditions. The student is injured or has badly bumped his or her head. The seizure happened in water. The convulsive portion of the seizure lasts longer than 5 minutes. A second seizure begins shortly after the first concludes. The person does not regain consciousness within 5 to 10 minutes, or the person has diabetes or is pregnant. But if a student who is diagnosed with epilepsy has a brief seizure and has not injured him or herself, calling EMS may not be necessary.
When you know that someone has a seizure disorder and someone has a seizure in your presence, whether it's a generalized tonic-clonic seizure or a different type of a seizure, generally speaking, you do not need to call 911 or rescue services unless the seizure is going on for more than 5 minutes.
When calculating the time, keep in mind there's always a period following the convulsions where the person is unconscious or extremely groggy. This is known as the postictal stage, and this time period is not included in the 5-minute calculation.
You may see somebody being very sleepy, really poorly, slowly responsive, and that would be described as the postictal stage. The seizure is over, and that's an important thing for people to understand, because the postictal period may go on for quite some time, for many minutes, even 15 minutes, 30 minutes. And in that time frame, that's not the seizure. So that doesn't mean, hello, the seizure is going on and you need to call medical services. You need to be there reorienting the individual, calming them, saying you know what happened and that they're going to be right back up and doing things shortly.
It's not something people need to freak out about, because chances are that person's had a lot of seizures before and they've bounced back every time.
Another common form of seizure that is not nearly as obvious is the complex partial seizure. Because only a small part of the brain is affected, a person may still be able to perform gross motor skills like walking or sitting upright, yet be totally unaware of his or her actions. They may stare, mumble, repeat phrases, blink excessively, smack their lips, or pick at their clothing. However, they will be totally unresponsive to instructions because their consciousness is severely impaired.
Let's say somebody were speaking to me. I might remember none of it,
Kevin.
a little part of it,
Kevin.
or it might be all jumbled together.
Kevin. Can you hear me? Can you hear me?
It can look like something else. It can look like a student's not paying attention. It may look like a student is using substances they're not supposed to be using.
I think it's important that a teacher not assume that the student is simply not paying attention or is, daydreaming, that they understand it is possible to have these more subtle forms of a seizure where the mind sort of just checks out for a few minutes.
Their consciousness is impaired. It's not lost, but they're clearly not processing language and they're not processing your intention. So that what you want to do is take harm out of their way, close the door. They will take the path of least resistance.
But a perception of being threatened will lead to somebody pushing away, hitting, fending off what, at least momentarily, as a reaction, is thought of a threatening move.
So that I think the most that you would want to do is guide. You don't want to restrict them. You don't want to force them to sit down. That is the last thing you want to do.
A complex partial seizure can last from 1 to 5 minutes. When it's over, the person may be tired or may recover immediately. Emergency medical services do not need to be called if a person who is diagnosed with epilepsy experiences a complex partial seizure, unless they're not fully recovered within 30 minutes. There are 2 additional forms of seizures school staff should be aware of: simple partial and absence. When a person has a simple partial seizure, their consciousness is not affected because the abnormal brain activity is occurring only in one specific area of the brain.
My arm is jerking. I can't stop it. It's not in my control. Brain that corresponds to that, the opposite side of the brain and the motor area of the brain, is making this happen, but it's uncontrolled, and that's a seizure.
Absence seizures, on the other hand, do affect consciousness and can easily be misinterpreted as daydreaming or ADHD in kids.
Were they just blank staring spells, maybe, with some eye blinks? But again, this little thing. The complex partial, there's more confusion after it. The absence, right back.
And when a person has an absence seizure, it's like a switch going on and off, okay? They're with you one moment, they're gone for a few seconds, and they're right back with you, picking up right where they left off.
No special action is required if a student who is diagnosed with epilepsy experiences an absence seizure, except to make sure the student did not miss something important being taught at the time. However, if you witness repeated episodes that you suspect may be absence seizures and the student is not known to have epilepsy, parents or guardians should be informed.
Some people know when they're going to experience a seizure. This would be called an aura. They may see or hear things before the event takes place. Some other considerations of seizure activity is to have a plan in place to provide privacy in case the student loses bowel or bladder control. Some use a beach towel that can be used for a drape. The child will also need a place to recover as they come out of the seizure. Not everyone that has a seizure has epilepsy. How the child wakes up can tell you the primary care provider a lot of information. Make sure to include that in your documentation as well. If a child has diabetes, then it is expected they will have a low blood sugar. If a child has epilepsy, then it is expected they will have a seizure. However, these situations above constitute a seizure emergency and the need for emergency personnel to be called. Many students who have epilepsy are well controlled on medication to prevent seizures. Airway patency and safety are a priority if the student does experience a seizure. Assist the child to the floor and, if able, turn them on their side. Make a safe environment by moving furniture away to prevent further injury. All students with a history of seizures shall have an emergency action plan that informs school personnel what the student's licensed healthcare provider has prescribed to treat the seizures, which may include Diastat rectal gel or oral disintegrating tablet called Klonopin. While staying with the child during a seizure activity, observe and compare the left side of the body with the right side. Look at what the arms are doing. Which way is the head turning? What is the mouth doing? What is the left side doing comparing to the right side? These are all important to the physician and can help locate where in the brain this activity is occurring. Always time the seizure. Never restrain or place anything in the mouth. They might bite their tongue, but they will not swallow it. Breathing will become shallow, so always make sure nothing is tight around their neck. For a diabetic that is unresponsive, we rush to give glucagon. For an allergic reaction, we rush to give epinephrine. For a known history of seizure, we usually wait before giving Diastat. Usually the physician will order the Diastat to be given 3 to 5 minutes after the start of the seizure. Waiting gives a few minutes to see if the activity will stop on its own before giving a sedative. Again, you would need to follow the child's seizure action plan. It would be best practice to keep the child inside the wheelchair when the seizure starts to prevent any harm to you. It would be best practice to keep the child inside the wheelchair when the seizure starts to prevent harm to you or the student. However, as with many seizures, provide first aid and make the environment safe to prevent secondary injury. Pad the wheelchair with something soft to protect and support the head. When receiving Diastat from the parent, the green ready label must be in view for us to keep the medication at school. If you do not see the green ready label, it means the medication cannot be administered as ordered. Do not accept it from the parents. Steps to administer Diastat. This will be part of your skills checkoff. For step number 6, it is recommended that the student faces you with the top leg drawn in. Picture number 9, gently insert syringe tip into the rectum where you will begin a 3-step of 3 process. Number 1, slowly count to 3 while gently pushing the plunger in until it stops. Number 2, slowly count to 3 before removing the syringe from the rectum. Number 3, slowly count to 3 while holding the buttocks together to prevent leakage. Please watch the following video for Diastat administration.
First, remove the protective cover. Then lubricate the tip with lubricating jelly. Turn the patient on the side facing you. Bend the upper leg forward, exposing the rectum. Separate the buttocks to expose the rectum. Gently insert the syringe tip into the rectum, and then count out loud, slowly. 1, 2, 3, while pushing the plunger in. Count again. 1, 2, 3, before removing the syringe. And finally, count. 1, 2, 3, one last time, while holding the buttocks together. After administration, and depending upon your prescription, there may be some unused medication left over. Remember, this prescription was for 15 milligrams that was dialed and locked from a 20 milligram Diastat Accudial diazepam rectal gel delivery system. That means that 5 milligrams will have to be disposed of. All you do is pull on the plunger until it is completely removed from the Diastat Accudial. Point it over a sink or toilet. Replace the plunger and push until it stops. Then just flush the toilet or rinse the sink until all of the gel is gone. As for the delivery system itself, just throw it and all other used materials in the trash and away from children, just as you normally would.
Diastat is Valium, which is a heavy sedative, plus the child who received this Diastat just had a prolonged seizure, so breathing may become shallow. Know who is in the building that is CPR certified. Turn the student on their side and monitor while waiting for EMS to arrive. Klonopin is another medication that is FDA approved for seizure management and for breakthrough seizures. We discussed this type of medication administration in Module 2 with oral medications. Non-FDA approved medications for management of seizures may not be delegated to school personnel. Please contact health services if the parents request any other type of seizure management. For your safety, we will be discussing the different options for Klonopin and locations of administration when you meet with a nurse for return demonstrations. You need to make sure you have gloves available for this administration as you are placing the medication in the student's mouth. After placing the pill in the cheek or gum line, you will massage the area to increase absorption. Opioid epidemic is on the rise and the addiction can happen to anyone. There are multiple reasons for the abuse and a few are listed here. Although adolescent opioid users start with prescription drugs, many switch to heroin due to price. Heroin is half the price of prescription pills. There has been significant rise in the number of adolescents aged 12 and older who have received treatment for heroin. Opioid overdose can affect breathing to the extent that breathing slows down and eventually stops. Oxygen starvation leads to unconsciousness, coma, and within 3 to 5 minutes without oxygen, brain damage starts to occur, soon followed by death. KRS 217186 allows non-medical school personnel to administer Narcan to a person that is experiencing an overdose. This is the same statute that includes a Good Samaritan provision. This chart outlines the difference between someone that is, quote, high versus someone experiencing an overdose. If you suspect an overdose, act promptly. Do not move the individual who is in severe distress. You will never prime Narcan before administering. If a person does not respond by waking up to voice or touch or breathing normally within 2 to 3 minutes, a second dose of Narcan may be given if available. After giving Narcan and getting the student stable, be sure to seize all illegal drugs and or non-prescribed opioid narcotics found on the victim and give them to the school administrator per school protocol. This student will need to be transported to the nearest medical facility. In the following video, you will see the steps to give Narcan.
Narcan nasal spray is an emergency treatment for a known or suspected opioid overdose. The appropriate use of Narcan nasal spray can help you save a life. Narcan nasal spray is not a substitute for emergency medical care. As with any drug, you need to be aware of important safety information concerning its use. If you encounter someone who is unresponsive and you suspect an overdose, first shake their shoulders and shout their name.
Kevin.
Ask if he or she is okay.
Hey, can you hear me?
Check for signs of an overdose, unresponsive to touch or voice. Breathing is slow, uneven, or has stopped. Snoring, gasping, or gurgling sounds. Fingernails or lips are blue or purple. Administer Narcan nasal spray as quickly as possible if someone is unresponsive and an opioid overdose is suspected, even when in doubt, because prolonged respiratory depression may result in damage to the central nervous system or even death. Lay the person on their back to receive a dose of Narcan nasal spray. Remove Narcan nasal spray from the box. Peel back the tab with the circle to open it. Remove and review the printed quick start guide inside the package. Hold the Narcan nasal spray with your thumb on the bottom of the plunger and your first and middle fingers on either side of the nozzle. Do not press the plunger to test or prime the device. If you do, you will waste all or part of the dose of medication. Tilt the person's head back and provide support under the neck with your hand. Gently insert the tip of the nozzle into one nostril until your fingers on either side of the nozzle are against the person's nose. Press the plunger firmly to give the full dose of Narcan nasal spray. Remove the device from the nostril after giving the dose. After you have given this medication, seek emergency help right away. Narcan nasal spray is not a substitute for emergency medical care.
I'm with somebody who stopped breathing. I think they've had an overdose.
Move the person on their side after giving Narcan nasal spray. If possible, put their hands under their head and bend their upper leg forward. This helps prevent the person from rolling onto their stomach. This is known as the recovery position. Continue to watch the person closely. If they do not wake up or respond to your voice or touch, or if they do not seem to be breathing normally within 2 to 3 minutes, use a new Narcan nasal spray to give an additional dose in the other nostril.
The majority of our policies were addressed in other modules. Please make yourself aware of 09.2241 AP.1 and contact Health Services for any question. Thank you for your time and your willingness to assist Health Services and the needs of the Bullitt County students. To complete your training, you will take the open book exam. Once you have passed the test and printed your certificate, you will register for the skill competency and check off to be held at the Board of Education or the Food Service Building. Details and the time to register can be found on the Health Services page or by contacting one of the nurses. Thank you.